All right. How's it going? My name's AJ. I'll be your nurse today. I've come in to just do a quick head to toe assessment from the neck up. Is that okay?
That's good with me.
That's okay. All right. So I would wash my hands, pull the curtain. The patient appears to be in overall good health. He does have a little boot on. I would, but do not need to get a full set of vital signs. And for the purpose of this assessment, I will only be assessing unilaterally, not bilaterally. All right, Shane. Are you having a good day today?
So far, so good.
Yeah. Can you tell me your full name and date of birth?
Shane Glenn Hayes, August 28th, 1989.
You know where you are?
At home.
Yeah. Why are you here?
Wellness checkup.
All right. All right. Let's see. What day is it?
Today is May 22nd.
May 22nd. What's the? What day? What day is
Day of the week.
Day.
Wednesday.
Wednesday, May 22nd. You know what time it is? I don't know if I know what time it is. 1:35.
1:35.
1:35. Wonderful. So, patient appears alert and oriented, ×4. So nothing abnormal there. So I'm gonna go ahead and I'm gonna palpate your head, or I'm gonna touch your head and make sure everything's okay.
Okay.
If that's fine with you.
Works for me.
Okay. So all I'm feeling here is that you don't have anything going on. Do you have any bumps, cuts? Have you hit your head lately? Fallen?
Not that I'm aware of.
No? Okay, I'm gonna palpate your sinuses here. Any pain while I'm touching?
No.
Okay, how about right here?
No.
Okay, perfect. All right, pause. Okay.
Okay.
Good job. He appears alert to his surroundings. His speech is clear and concise, easy to understand. His affect is appropriate for his current status. There's no flatness or anything to be of concern. Now we're going to move on to the cranial nerve assessments. So Shane, what I'm going to do is just kind of run through the 12 cranial nerves and kind of pick on you a little bit, if that's okay.
That'll work.
Okay, so for the first cranial nerve, 1 is the olfactory. So I'm going to plug your nose, one nostril. You'll close your eyes or not, it doesn't matter, and just tell me what you smell, okay?
Okay. Make sure you're staying closer because I can't see it.
Sorry.
Okay.
Okay. Can you tell me what you smell?
Smells like coffee.
Coffee? Good job. All right, now I'm going to take a peek up your nose real quick. So the turbinates appear normal. They don't appear inflamed or anything. Are you having any nasal problems, congestion, difficulty breathing? Great. Awesome. Next, we're going to move on to the second cranial nerve. What is it? Optic. So we're going to assess your pupils. Oh, that is okay.
Yep.
So just kind of look straight ahead for me. And again, I'm only doing unilateral. I'm not going to do both eyes. So currently his pupils appear to be around 2-3 centimeters. I mean, the lights are on in here, so we'll just make sure they react to light. Sorry, that's super bright. Okay, they are reactive. They're brisk. There's no delay. All right, so now Shane, I'm gonna have you focus on. There's a picture of Jesus in the background. I'm gonna have you focus on my thumb, and then when I tell you, I want you to focus on the picture of Jesus. Okay? All right, ready? Look at Jesus. That's cool. All right, so your eyes dilated, which is absolutely normal. Never done that before. That was cool. Okay. So now we're gonna assess your cranial nerves 3, 4, and 6 that kind of all go together essentially. It's the oculomotor, the trochlear. Am I in? I think I'm in. What did I say? Oculomotor, trochlear, and the abducens. So here we're just gonna I'm gonna cover your eyes. We're gonna cover one eye and have you focus, and I'm gonna just look and see if you have any rapid eye movement.
Okay.
Okay. So I'm just gonna cover this eye, or you cover one eye. All right, and then look at Jesus, and then kind of look at me. Okay, as far as my understanding of that, I'm not seeing anything normal, no rapid jerks or anything. It seems to be fine. Okay, and now I'm gonna go ahead and do the 6 fields of gaze. So just follow me. Just follow me as I go. All right, ready? Okay. any trouble with that? I know you're elderly. That's perfect.
Nope.
Nope. Score 100. All right. Let me pause that. All right. Now we did 3, 4, and 6. So we're gonna do cranial nerve 5, which is your trigeminal. So if you open your mouth for me and just move your jaw from side to side. Any pain or anything there?
No.
No popping. Team J, nothing crazy. Okay, great. All right, now I'm gonna use this cotton applicator, and if you'll just kind of tell me where I'm touching, it doesn't have to be specific. Just tell me the general area.
My right cheek. Forehead.
Great. I guess we can.
Tip of my nose.
Yeah, that's a nice sneeze. Okay. Clench your teeth and smile.
No.
Okay, you're normal. We'll move on to cranial nerve 7. That's your facial nerve. So give me a big smile. Smile appears even. Puff cheeks. And let's see. Can you squint your eyes? Yeah. There might be a nerve missing in that area. I think you're fine. Okay, cranial nerve 8 is the vestibulocochlear. So if you'll plug your left ear for me, I'm gonna whisper really quietly.
Okay.
And you tell me the 3 things that I say, okay?
4, 5, 6.
Great. Awesome. That appears intact. As far as I can tell. Did you have any trouble hearing it all?
No.
Okay. So cranial nerve 9 is the hypoglossal, and I'm not no, cranial nerve 9 is the glossopharyngeal, and cranial nerve 10 is the vagus. So what I'm gonna have you do is, I would love to do a gag test. No, I'm just playing. It's horrible. So if you could just say "ah" for me, I'm gonna look in your mouth. So his uvula did rise at first, and then it settled back down. I don't know if it's supposed to. I don't think it's supposed to stay. Perfect. Yeah. Awesome. That's cool. So that went up and then came back down. Let's see. You don't have any. I didn't see any tonsils. Let me double check. Do you have tonsils?
No.
Okay. Yeah. I'm not sure what tonsils look like. It's cool. Okay, cranial nerve 11 and 12. So we're gonna do accessory, and then the cranial nerve 12 is the hypoglossal.
Okay.
For the accessory nerve, just shrug your shoulders for me. They both shrug evenly. Any trouble with that? Okay. And then the hypoglossal, stick your tongue out. So his tongue is midline. Can you go side to side with it? And up and down. Perfect. All right, awesome. So I'm gonna go ahead and do the lymphatic system now, and I'm not super comfortable with the lymphatic system, so I'm gonna kind of check my notes as I go through the 12 checkpoints that we're supposed to do. So the first one I'm gonna check is the pre-auricular, and my understanding it's just right behind the jaw, right here in this area, kind of right below the pinna of the ear, or not the pinna, right below the earlobe. Do you have any pain with that?
No.
I don't feel anything. The post-auricular is a little bit lower, same area. I mean, I think I feel irregular with those. I'm assuming that's that.
Yep.
No, they don't feel huge. I can feel those. It's neat. Okay, the occipital will be the next one. I'm gonna rotate it around here. Hopefully the camera can see. No, I can't really feel it there. I know it's in this area. No pain there though?
No.
Okay. And then the submental is under the chin. I wonder if you only can feel them if they're inflamed, you know?
Mm-hmm.
Like if they're just big. And then the submandibular is a little bit wider. I wonder if these are the submandibular. The one that was from earlier. Right there. Anterior cervical. Above the clavicle right here. Nothing there. Okay. Tonsillar. These are probably the tonsillars. Okay.
Yeah.
So the tonsils I can actually feel, I believe. That's them. I feel them bilaterally. Post cervical. Behind the neck. Didn't he do occipital? Or axis? Maybe post cervical is right down here, lower. Lower behind the neck. I'm guessing occipital would have been up here. Post cervical. Supraclavicular and infraclavicular right outside here. We're doing supraclavicular right now. And then infraclavicular. Alright. And that concludes the lymphatic assessment. So now I'm gonna move on to your ear, which will be the last part. Kind of jumped around there, but so I'm gonna turn you to the side here. I'm gonna talk about your external ear, and then I'm gonna look in your inner ear. Okay. So here we have his helix, and then the antihelix right down here. We have his tragus, his antitragus, and then lobule. How do I keep forgetting that lobule? So that is present. And then, all right, I'm just gonna look in your ear here. Okay, and so in the inner ear, my best guess of looking, I'll go back. Oh, look at there. So I'm not super familiar with the ear. My best guess is I'm pulling the pin up and back as well, but I remember what was on the PowerPoint is FUTL, flaccida, umbo, tensa, and the cone of light. Now I'm kind of sorry if you're having any pain. Let me know. Is that too deep?
No, you're good.
So his ears are very clean. Oh, I can see the cone of light. That's cool. Maybe the flaccida is there at the top that I can see decently, or the eardrum is intact. It's not perforated. Have you ever perforated your eardrum?
Nope.
Okay, now I believe I have a good view now. So I do see the flaccida right next to the little white line. And then the umbo is kind of hard for me to tell. And tense is down at the bottom. And then the cone of light is on the right side. So that was awesome. Well, thanks for having clean ears, Shane.
You're welcome.
Thanks for letting me do my head to neck assessment. And now I'm going to go ahead and start with the general assessment. You know, we did the head to neck, but I guess it's also, I think it was in the river. Just it's basically skin, nails, and hair. So hair, no baldness, no dryness. You don't have any flaking. Facial hair, red and healthy. It's not as pretty as mine. All right, can I see your one hand? So fingernails, they're beat up, chewed up. No clubbing, no blueness. I don't see any like lines or like striae in his fingernail bed. Cap refill. Definitely less than 3 seconds. I'm just gonna feel your pulse. So pulse is probably +2, not bounding, not threading, not easily obliterated, consistent. Okay. I don't know, is there anything else? I think that's it. Skin turgor?
Yeah.
So skin quickly returns, no tinting or anything. So I say you're adequately hydrated, my friend.